ನೆಕ್ಸ್ಟ್ ರೇಡಿಯೋ ಆ್ಯಂಡ್ ಟೆಲಿವಿಷನಲ್ಲಿ ಬರೋಂಥ ಪ್ರೋಗ್ರಾಮ್ಸ್ ಆಗಿರ್ಬೋದು, ಅದು ಲಾರ್ಜ್ ನಂಬರ್ ಆಫ್ ಆಡಿಯನ್ಸ್ಗೆ ರೀಚ್ ಆಗುತ್ತೆ ವಿತ್ ಜೋಕ್ಸು, ಸ್ಟೋರೀಸು, ಡ್ರಾಮಾಸು. ಸೊ ಅದರಿಂದ ನ್ಯೂಟ್ರಿಷನ್ ಪ್ರಾಬ್ಲಮ್ಸ್ನ ಗುరించి ಅವೇರ್ನೆಸ್ ಕೊಡ್ಬೋದು. ನೆಕ್ಸ್ಟು ಅಡ್ವಾಂಟೇಜಸ್. ಏನೇನು ಅಡ್ವಾಂಟೇಜಸ್ ಇಸ್ ನ್ಯೂಟ್ರಿಷನ್ ಎಜುಕೇಷನಿಂದ ಇಟ್ಸ್ ಇಂಟರ್ ಡಿಸಿಪ್ಲಿನರಿ ಆ್ಯಂಡ್ ಫೆಸಿಲಿಟೇಟ್ ದ ರಿಲೇಷನ್ಶಿಪ್ ಆ್ಯಂಡ್ ಇಂಟಿಗ್ರೇಟಿವ್ ಆ್ಯಂಡ್ ಎನೇಬಲ್ ಸಸ್ಟೈನಬಲ್ ಆ್ಯಂಡ್ ಲಾಂಗ್ ಟರ್ಮ್ ಬಿಹೇವಿಯರಲ್ ಚೇಂಜಸ್. ನೆಕ್ಸ್ಟ್ ಲಿಮಿಟೇಷನ್, ಲ್ಯಾಕ್ ಆಫ್ ರಿಸೋರ್ಸ್, ರಿಮೈನ್ಸ್ ineffective and requires specific skills. These are limitations of this nutritional education. Next one, the diet therapy. What is this diet therapy? Diet therapy is concerned with recovery from illness and prevention of disease. ಅಂದರೆ ಡಯಟ್ ಥೆರಪಿ ಅಂದರೆ ಇದು ನ್ಯೂಟ್ರಿಷನಲ್ ಥೆರಪಿ. ಇದರಿಂದ ಈ ಥೆರಪಿಯಿಂದ ಇಲ್ನೆಸ್ಸು ರಿಕವರಿ ಆಗಿ ಮತ್ತು ಡಿಸೀಸ್ನ ಪ್ರಿವೆಂಟ್ ಮಾಡ್ಬೋದು. ಈ ಡಯಟ್ ಥೆರಪಿ ಸ್ಪೆಷಲಿ ಡಿಸೈನ್ ಆ್ಯಂಡ್ ಪ್ರಿಸ್ಕ್ರೈಬ್ ಫಾರ್ ಮೆಡಿಕಲ್ ಆರ್ ಜನರಲ್ ನ್ಯೂಟ್ರಿಷನಲ್ ರೀಸನ್. ವಾಟ್ ಆರ್ ದ ಪರ್ಪಸ್ ಬಂದು ಇಟ್ ಪ್ರಮೋಟ್ಸ್ ಬ್ಯಾಲೆನ್ಸ್ ಸೆಲೆಕ್ಷನ್ ಆಫ್ ಫುಡ್ and it also appropriate of individual for drinking proper amount of water. Nutrition plays large role in determining height, weight, strength, physical agility, skeletal muscle development, appetite, posture, completion, emotional health, resistance to disease. Essential micronutrients ಅಂದರೆ used by the body to perform body functions. Usually these essential nutrients divided into 6 groups: carbohydrates, fats, proteins, vitamins, minerals and water. First one is carbohydrates, major source of human energy. It available in the form of starch and sugar, and it's easily digestible and well in most climates, keep well without refrigerator. Main source of carbohydrates: bread, cereals, pasta, crackers, potatoes, corn, peas, fruits, sugar and syrup. Next, fats are nothing but lipids. It provides flavor to meal and it's maintain body temperature. It's concentrated form of energy. Main source: butter, oil, cream, fatty meats, cheese and egg yolk. Excessive cholesterol is believed to contribute atherosclerosis. And this cholesterol fatty substance found in body cells and animal fats like eggs, meat, shellfish, buttercream, cheese, milk, organ meats. Next to proteins, it's also help for build and repair body tissue. It provide heat and energy, helps to make antibodies, and it's make up of 22 amino acids. In that 22 amino acids, 9 are essential amino acids. Main source bandu meat, fish, milk, cheese, eggs. Incomplete proteins: cereals, soya beans, dry beans, peas and peanuts. Next to vitamins, organic compound that essential to life. It's regulate body functions and it's repair body tissues. Only small amount required to well balanced diet provides required vitamins. Excessive or deficiency can lead poor health. Vitamins, water soluble and fat soluble vitamins are there. Next, minerals. It's inorganic elements found in all body tissues. It's regulate body functions and build and repair body tissue. They include calcium, phosphorus, sodium, potassium, iron, iodine, fluorine and etc. Next, water found in all body tissues. It's essential for digestion and it also make up of most blood plasma, helps body tissue absorb nutrients, and also it helps to move waste material through body. The average person should drink 6 to 8 glasses of water per day. Next, basic food group. Basic food group: milk group, meat group, cereal group, and green leafy vegetables and fruit groups. Milk groups like including dairy products. Meat groups: meat, fish, eggs, etc. Green leafy vegetables and fruits, vegetables and fruits. Cereal group: bread, rice, wheat, and barley. Next, what is therapeutic diet? Already we saw therapeutic diet and diet therapy are both same. Therapeutic diets is important as medicine in the treatment of disease. Therapeutic diet and it's a diet as important as medicine in the treatment of disease. Also, a modification in diet and nutrients can cure certain disease. What are the characteristics of therapeutic diet? It's plant diet, it's modified normal diet, it's prescribed by doctor or dietitian, used to supplement the medical or surgical treatment. Next, what is diet therapy? Diet therapy is concerned with recovery from illness and also prevention of disease by diet. Removing or adding food, changing nutrients or calories, increase or decrease energy values, increase decrease in bulk in diet. Next, purpose of diet is regulate amount of food, assist body organs to maintain normal functions, and it aids in digestion. It improves specific health condition. It decreases body weight, prevent dehydration, improve appetite, provide adequate nutrition, meet metabolic needs of human body. Next, type of therapeutic diets: regular diet, liquid diet, soft diet, diabetic diet, calorie control diet, low cholesterol diet, sodium restricted diet, high protein diet, low protein diet, low fat diet, bland diet, low residue diet. First one, regular diet. Regular diet, balanced diet, usually used for ambulatory patient. At the time of a slightly reduced calorie content, foods such as rich desserts, creamy sauce, salad dressings, fried foods may be decreased or omitted. Liquid diet. This must be used in patients who are unable to tolerate solid food. Usually, this diet given in the hyperpyrexia, post-operative patient, and GI problem patient. This liquid diet usually nutritionally inadequate and it should use in short period of time. For example, after surgery, heart attack, patient with digestive problems and acute infection, to replace loss of fluids from vomiting and diarrhea before going to extra digestive tract. Next, in liquid diet, clean fluid diet or liquid diet or next clean fluid diet or clear liquid diet. This include clear tea, black coffee, clear soups, whey water, fruit juice, etc. This diet you only used in the short time of. Next, full liquid diet is totally nutrition patient as maintained by fluid for considerable time. It's usually used in the patient who is unable to swallow solid food and patient with nasogastric tube. Low residue diet. Low residue diets mainly used in the digestive and rectal disease. Eliminates or limits food high in bulk or fiber, such as raw fruits, veggies, whole grains, cereals, nuts, seeds, beans, etc. Next, calorie control diet, low calorie diet and high calorie diet. Low calorie diet. Low calorie diet, total calorie intake is reduced to less than body requirement. What is the main aim? Main aim to slow or steady the loss of weight. This diet is advisable for obesity patient, like salads, fruits, boiled vegetables. The patient must have plenty of bulk in diet using high fiber food. Low calorie diet. What are the things you have to avoid? Ghee, butter, cream, sugar, whole milk, creamy soups, gravies, sweet, soft drinks, alcohol beverages, salad, fatty meats, candies, rich desserts you should have to avoid. High calorie diet patient who is underweight or anorexia nervosa or hyperthyroidism or cancer. Extra proteins and carbohydrates are included. You have to avoid high bulk food like green salads, watermelon, and fibers food. Avoid high fat food such as fried food, rich pastries, cheesecakes because digestion slowly and spoil appetite. Next, protein control diet, high protein diet and low protein diet. High protein diet, the protein intake should be 75 to 100 gram a day. It's usually used in PEM or a high nutritive value protein should be given. High protein diet is given in children and adolescents who need additional growth, pregnant and lactating women, before or after surgery, burns, and TB. This regular diet with added proteins such as meat, fish, milk, cheese, egg, dal, soya beans, groundnut. Low protein diet. Low protein diet advised in kidney disease such as nephritis and uremia. In this disease, protein is avoided or given in the moderate level. This type of diet is given to rest to kidneys. Foodstuff like milk, eggs, meat, nuts, beans are avoided. Next, diabetic diet. In diabetic diet, the metabolism of carbohydrates and fats, proteins are affected. So, purpose is to keep the patient in good health and keep blood sugar level within normal level, and to keep urine from sugar. The diet should be balanced but restricted of carbohydrates like rice, biscuits, sugar, jam, sweets, honey, carrots, and sweet potatoes. The patient should take eggs, milk, raw salads of all type of green leafy vegetables. Low cholesterol diet, restriction food containing cholesterol. Used for patient with atherosclerosis and heart disease. Limit food in high saturated fats such as beef, liver, pork, egg yolk, creamy cheese, shellfish, whole milk, coconut, and palm oil products. Low fat diet or fast fat restricted diet. Patient with liver disease, gallbladder disease, obesity, heart disease. Carbohydrates in disease should be increased to supply the liver with glycogen to prevent ketosis. No fried food, ghee, butter, oil is allowed in diet. Only roti, rice, bread, fruits, dal, vegetables should be taken. Next, sodium restricted diet or low salt diet. Sodium is totally partially restricted, depend on severity of condition. The patient with heart disease, kidney disease given salt restricted diet or low salt diet. The following should be avoided: salt, baking powder, papad, canned food, cheese, pickles, salted chips, and biscuits. Next, iron rich diet. Iron rich diet given in anemia. The diet should be provide necessary nutrients for the formation of new RBCs and hemoglobins. The food recommended: liver, meat, eggs, spinach, drumsticks, ragi, jaggery, dates, and beet. Next, soft diet. Soft diet used in acute infection following surgery of patient unable to chew. It made up of simple, easy, and digestible food, contain more fibers. Normal diet. Normal diet is used for ambulatory and bed patients whose condition do not necessitate special diet. Next, therapeutic diet for malnutrition. Already we saw high energy and high protein, energy and nutrient dense food. Use supplements of recipient fortification and encourage resident like to eat the high energy and high protein diet. This is regarding diet therapy or therapeutic diet.